In a single day, the Busia border post handles between 250 and 500 trucks entering into Uganda. That number has drastically dropped almost to nothing after the government declared that all those seeking a test for COVID-19 must pay a fee equivalent to about 245,000 shillings.
Today, the implementation of the COVID testing fees was piloted at Maraba border crossing point, and later in the day, the Ministry of Health teams with the bank that is hosting the COVID testing fund, StanBIC, will assess how best they can extend this to other service points.
The truckers declined to pay the fee, seeing it as unbearable. More than a dozen trucks were today parked on either side of the frontier, with operators waiting for possible reduction in the test fee.
For that one, for us, we are waiting for the drivers. Papers are ready, but there's no driver in the truck. So meaning we are not having anything to do right now. We expected Ministry of Health to adjust the measure and the drivers come on board and test and they go. But all in vain, they have not yet turned up.
Previously, authorities have tried their best to ensure regional and international trade continued. This is why the Minister of Trade, Industry and Cooperatives is now looking to reach consensus to ensure continuation of trade. However, the test fees was imposed on all truck drivers entering the country, individuals seeking to know own status, private organizations seeking to test staff for purposes of prevention, returnees from abroad and visitors arriving into the country. While those excluded from the category of those required to pay are patients who present to health facilities with COVID-19 symptoms, contacts of those who have tested positive, community survey tests conducted by the ministry, and the frontline health workers. However, civic leaders have spoken out against the charges.
The last we heard from him, the update he gave us, they had accumulated collected a sum of 30 billion Uganda shillings from well-wishers, from good Samaritans, who generously contributed to a tafari. So we are asking Mr. Yoweri Museveni and his government, what happened to the money you collected from Ugandans through that committee of Emmanuel Katongoro of Quality Chemicals? What happened? That money should be utilized for this particular purpose.
More than 300,000 tests have been conducted, in which just under 3,000 have tested positive, while at least 32 people have succumbed to COVID-19 pandemic. At least 1,489 have recovered. Jackson Onyango, NTV.